The importance of knowing that is, if a patient, okay, to get your minute volume, we're going to talk about that in a second, is a formula. Tidal volume times respirations per minute. Okay? So each time you breathe, how much you take in times how many times you're breathing a minute. So if you're breathing faster, do you think you're taking in as much air? No. You're actually taking in less air. So as you're taking in less air, your body has to continue to breathe harder to take in the same amount of air it normally uses in a minute.
Which is when you go into your anaerobic system.
Exactly. Anaerobic metabolism, and that causes a problem with gas exchange. Okay? Yes. I like it. I like it. All right. So the exhalation process is passive. It literally just is the relaxation stage. Everything just kind of chills out, the muscles relax, the thorax actually compresses air out of the lungs. So it just kind of slowly but surely rises or sinks, and the air moves out on its own. Okay? And all the air is moving in and out via the trach. Now, there's no real effort to breathe out. The only time you'll see, if you see somebody having trouble breathing out, typically it's because of something known as obstruction. And what we mean by obstruction is not necessarily that there is something per se physically blocking, but like in the instance of asthma, the bronchi are tight, there may be mucus, what have you. Remember that word I told you before, surfactant? Okay, did y'all write it down? Because you're gonna need to know it, and you're gonna hear that a lot. I say that word probably every class from here on. The word surfactant, S-U-R-F-A-C-T-A-N-T, surfactant. The thing to know about surfactant is this is the only fluid through which gas exchange can take place in the lungs. It cannot take place through water, it cannot take place through mucus, it cannot take place through serum or blood, it can only take place through surfactant. What surfactant is the fluid, the small amount of fluid that sits in the alveoli to keep them moist and keep them open. I'll talk about my hands. Okay? It keeps the alveoli moist and keeps them open. Okay? Or helps to keep them open. And if you think about it, the reason it's so important to maintain a clear airway for your patient all the time is it literally is like the Bull River Bridge. There's one way in and one way out. Okay? Once you get on Tybee, you're stuck. Right? Anybody ever been out there when there's an accident? Good luck. 3, 4 hours, 5 hours, 6 hours of nothing. Hope you got gas. Okay? So that's what you have to think about in that instance is there is only one way in and one way out for gas in and out of the body, and that is through the trachea. So if there's any compromise to the trachea, the oro or nasopharynx, we've got a problem. We have to fix that quick. That's why A and B are everything. If you don't have an A and B, is C going to matter for very long? No. Because what are you going to circulate? Nothing. Right? You're going to circulate the waste that's, or literally the air poop that's in the body, and your body's going to eventually go into cardiac arrest because it is oxygen deficient. It's going to go through the 5 phases. Normal, agitated, anxious, altered, unresponsive. Right? So it's going to go through all those phases. Alright? So in ventilation, this has to do with the receptors in the body. Okay, or what's referred to as chemoreceptors. Chemo, C-H-E-M-O receptors. Okay, so there's a constant communication that goes on between the chemoreceptors and the brain. Okay, and in this communication it says, we've got X amount of CO2, we need to breathe. We've got X amount of CO2, we need to breathe. We don't have enough oxygen, we need to breathe. And this is how they maintain that diffusion of CO2 and oxygen. Only so much needs to leave. That's why every breath you breathe is not the same. Sometimes you'll be breathing, and you'll be breathing normally, and then all of a sudden your body will take a little bit deeper breath because your body says, hey, I got a little bit extra carbon dioxide I need to get out, or I need a little extra oxygen at some point, right? And so it depends on what's referred to as myocardial oxygen demand, and that is how much air does the heart need at any given time, okay? So this happens because of the gas concentration that's in the bodily fluid, specifically in the blood and the CSF. What's CSF? Cerebrospinal fluid. Okay? This is the fluid that bathes the brain and the spinal cord. Okay? So that is where your chemoreceptors are. Well, one set of chemoreceptors are. The other is actually within the bloodstream. So the body is constantly getting feedback. It's no different than your ECM in your car. That's constantly saying, okay, everything's running like it should be, this, that, the other. Wait a minute, something's not running right. So start throwing codes, things like this. That's exactly what's happening. It's constantly running checks. It's like your malware, spyware on your computer. It's constantly running in the background to say, okay, everything's like it's supposed to be. This needs to be happening. This needs to be happening. This needs to be happening, without us even thinking about it. Because truthfully, if we had to think about breathing, we'd be dead. If we had to think about breathing, we would be dead. Okay? So, if we don't meet that myocardial oxygen demand need, we're going to suffer from hypoxia. And the longer we're hypoxic, okay, this is a very, very dangerous condition. Okay? The tissues don't get enough oxygen. Ultimately, it's going to cause those stages of mentation change. And the patients will die very quickly. It only takes 12 minutes for brain death to start. So before tissue in the brain starts to die because of lack of oxygen, it takes 12 minutes. For the heart, it only takes 8. Okay? It does not take long. Doesn't mean the heart completely dies after 8 minutes. It just means that an area that's affected by not having tissue is going to get larger and larger and larger, starting at around the 8-minute mark. Okay? And it may have irreversible damage. And that's what we don't want. Okay? So the area in the brain that we call the pneumotaxic and the apneustic center, and it states those in your book, the apneustic and pneumotaxic center monitors and changes the rate and depth at which we breathe based on what it feels we need as it sees what's actually in the bloodstream at any given time. Okay? Y'all take a quick break before we get into oxygenation.